Hi everyone, this PowerPoint for this class is about working with vulnerable population. The objective of this topic would be to describe vulnerable population and name population that are considered vulnerable, risk for health disparities for some vulnerable population, factors affecting the vulnerable population, and how to help. So according to Javahogi, the words vulnerable population simply imply the disadvantaged subsegment of the community requiring utmost care, specific ancillary consideration, and augmented protections and research. The vulnerable individual's freedom and capability to protect oneself from intended or inherent risk is variably abbreviated from decreased free will to inability to make informed choices. So vulnerable population is mostly the people that can't take care of themselves without help. So who are the vulnerable? We can think of people around us, the children, minors, pregnant women, fetus, human in vitro fertilization, prisoners, terminally ill, comatose, physically and intellectually challenged individuals, the elders, the minorities, illegal immigrants, refugees, low-income children, people with HIV and AIDS, homeless people, and people that are uninsured. So this is a picture of people that are around us in a daily basis that can be considered vulnerable people. So for the health disparities, um, so I'm going to talk about differences in the inequality in healthcare. The term health inequality generically refer to difference in the health of individuals or group. So in this world we are our population is really diverse. So sometimes in the healthcare system, we have prejudice, and sometimes different ethnicity or gender are not treated equally. So policymakers and researchers and other healthcare practitioners um, have tried to improve overall population health, but also to reduce and eliminate differences in health based on geography, race, ethnicity, socioeconomic status, and other social factors. For example, in the U.S. infants mortality rates are nearly 3 times higher for non-Hispanic blacks versus whites. African American, Asian, and Hispanic have more chronic disease, cancer, diabetes, and infections than any other racial groups. African American women are more likely to die from cancer than any other racial groups. Um, I wanted to talk about the older population and why they are vulnerable. And um, so more people are living longer now. Um, by according to the U.S. Centers for Disease Control and Prevention, by 2030, 1 in 5 Americans will be a senior citizen, nearly double the 12% in 2000. Many of those older population, they can't afford um, help at home. They can't stay home by themselves, but they can't afford it. Um, and also, most of the time, Medicaid or Medicare does not pay for long-term care. So those people are a vulnerable population that needs a lot of help from us. Um, Next will be Americans that live in rural areas. So people that live in rural areas have less access to health networks and healthcare providers. They have greater rates of disability and chronic diseases, um, and they have a higher use of all public healthcare programs. Because of the high rate of self-employment and small business employment, rural Americans have lower rates of employer-provided benefits. Most of the rural Americans are uninsured or underinsured for a long period of time, according to the Center of Rural Affairs. Um, and also, um, many healthcare practitioners, doctors, are not willing to go and work in those rural areas. Um, so the rural Americans have to um, drive and travel distance for healthcare, and sometimes they don't have money for transportation to get there. So they end up staying home and dying from their diseases, or just the disease just get worse. Okay, so next I want to talk about the immigrants and English non-speaking patients. Um, Most illegal immigrants will stay home when they're sick because they're scared to seek care due to not being insured and also to the fear of getting deported. And many non-English speaking patients also are scared to go to hospitals because they feel like they require interpreters, and sometimes they fear that we won't have an interpreter available for them um, to be able to tell us what they need. Um, Many immigrants don't have insurance, they don't have money to afford the medication because of their low income, and they live too far, so they lack transportation, and also they don't have money for medical expenses. And they also fear of injustice and discrimination. Um, in the history of the United States, there has been a lot of racial division. So a lot of the immigrants feel, scared to get discriminated if they go to, you know, a healthcare, a medical center or a healthcare facility for help. So the factors that can affect a vulnerable population will be access to healthcare. We talked about it, how most of them don't have insurance because um, of their job. They don't have a job, so they don't have insurance, or they don't have money to pay for insurance. Transportation, they can't afford to pay for transportation to get to a healthcare um, facility, or they don't have the money to take the bus or the train, um, and there's no medical centers around um, for them that are close by for them to be able to get there without needing transportation or money. Also, education. Um, a lot of the vulnerable population have low literacy level, um, so they are unable to, inform themselves, especially online, or reading flyers. So that could prevent also being affecting factors. um, Lack of community nurses to educate about prevention. I feel like we do need a lot more community nurses that can go around and teach the vulnerable population regarding disease prevention. And the language barrier, because a lot of the vulnerable population, um, are non-English speaking people, or just immigrants that cannot speak English. So the HRSA, which is the agency of the U.S. Department of Health and Human Services, They're here to help. They work to reduce risk to vulnerable population and to help communities, non-governmental organization, and government provide services and protection for at-risk groups. So these programs are set up to help vulnerable population gain access that can support um, their health. Um, their job is to increase access to healthcare and quality services um, by bringing them to their community and by recruiting healthcare providers to work in vulnerable populations instead of um, the vulnerable population having to drive far to get to them. So we have they also dare to build health communities um, by hiring more community nurses or by having people that go around to educate and inform about health promotion and disease prevention. Ways that we can help as nurses will be to volunteer. Um, I know sometimes it's hard to volunteer when you work, a full-time job, um, and you have a family to take care of. But sometimes, you know, volunteering one day a week or every one weekend a month can really help um, the vulnerable people because we can go around and educate them, which can prevent a lot of diseases. Community nursing as a career. I'm not really sure how much um, how much a community nurse gets paid, but I feel that a lot of nurses should look into being um, specializing to community nursing, which will be able to help a lot with those vulnerable population. Those will be ways to help them. And these are all the references that I used. Um, so I hope that you guys receive some good information from this slideshow. Thank you.